Well, your doctor and your consultant says you need surgery. Do you really need surgery though? I was having a conversation in some training with my colleagues recently, and I was saying, oh gosh, patients come in, they go, oh, do I need MRI? I'm like, oh gosh, it's not that we're holding you back from that, but we have to have this really adult conversation about it, because we can almost know people and know people's mind behaviours enough to kind of go, well, oh, surely that's going to be more reliable than your experience. But the answer is no, it's not. It really isn't. We think the camera never lies, he says, looking at two cameras right now. We think the camera never lies. I'm afraid it does. I don't really look like this, and actually, joking apart, neither is your body look exactly like the MRI scan would suggest. What am I talking about? Well, at least 50%, at least 50% of people that have never experienced pain in their back at all have got disc prolapses, slip discs in the bottom two vertebrae. Let's just sink that in for a minute. You've never felt pain, but you may have significant disc bulges in 50% of the asymptomatic population. Over 60% of people have got torn tendons, completely ruptured tendons with a normally functioning shoulder that are totally unaware of the fact that they have a problem. When we scan the normal population with no problems, just as part of research, we find huge anomalies. Yeah, torn tendons, inflamed bursas. Yeah, subacromial impingement. Oh, well, you go and see a shoulder surgeon and say, we've got subacromial impingement, we've got a bit. Well, that's what's causing your pain. Is it? Well, we can't say that. It is not. I know it's like, oh, that throws the cat amongst the pigeons. I'm really sorry, but this is where, good surgeons, and there are many of them, so I'm not criticizing surgeons, because, I recommend surgeons, people to surgery all the time, if it's necessary. But we need a really wiser, broader, experienced narrative around that, and so I would encourage anybody that is looking at surgeons to and frankly, whether it was me as a clinician or your consultant surgeon, anybody, in my opinion, worth their salt would not mind being questioned about that. If somebody wants to question, I don't get upset about that, and if a surgeon gets defensive about that, I personally would walk away, because he's not the surgeon for me. Yeah. Of course, we all see things through our own lens. I'm a physio. Yeah, they're surgeons. Of course, they operate. Of course, I do what I do. I like to think that I try to make it my job to be as aware of where surgery is warranted, and to be able to see the place for all things. And I don't doubt that I've got some conformational bias. It's an inevitability, but I really try to minimize that. And so if we know that half the population are going around with disc bulges, we might go, oh, well, that's really confusing. But the beauty is it's also liberating, because it says, well, just because you've got that on your scan doesn't mean that that's bad news, or that you have to have surgery. Yeah. What we need to do is we need to put it into the picture of going, have you tried a good course of physiotherapy? And I'm not just talking, a sheet of exercises and off you go for 6 weeks, because that's not physiotherapy. It's not good physiotherapy. Now, have you undergone an exhaustive course of treatment which has looked at many of the factors, including your strength, your flexibility, perhaps use manual approaches? Have they actually looked at your mind-body relationship and seen what's going on, and the history and the patterning of the pain? Has it come on in association to, traumatic events in your life, or what have you? Let a really, really rich understanding of you as a person. When you've done that and you've exhausted these other things, and a skilled clinician and the skill and experience of an experienced practitioner should be able to say, listen, yeah, okay, you've got very, very dermatomal pain here. We're doing these things, and their experience is this does look like a nerve root irritation. Let's try and work with that. Okay, this looks pretty cut and dried mechanical. Of course, there's some sensitization in the brain, because it's inevitable when if you've had it for a while. But when we've done that, and we've excluded things, that is the point where we might say, okay, let's try surgery. Now, people often I don't want to wait that long. I just want to know what the right thing to do is, and I want to know what the right thing to do is day one, and I don't want to mess about for 6 weeks trying physiotherapy. Well, I'm sorry, it doesn't work like that. Surgery should be the end result, unless of course we're talking about an emergency situation where, you know, you've got cauda equina and I'm going, okay, do not pass go, get your wife to drive you straight to hospital right now. I'm going to contact the surgeon, and we're not messing about. You know, there are important things, red flags, that we would go, let's get this investigated, and you may need surgery, toot sweet. I'm not talking about that. I'm talking about the everyday back pain where I'm going, look, let's try anything and everything we can to get rid of this, because it simply isn't, there's a bulge, I need to chop it out. There's a piece of bone under here, because half the world, over half the world have got that. And it's certainly, those numbers go up to 70, 80%. If you're talking about a 70-year-old, you are looking at 80% of the population that don't have pain, have bulges in their back. And, you know, I hope in this video that I'm just able to maybe prevent people having unnecessary surgery, because this accounts for many of the people and those unfortunate stories, which are much, much less these days, because surgeons are aware of this information. Those sad situations where somebody has surgery and then they're worse, or they go, I wish I'd never had it done. And I don't want that to be you. I'm not knocking surgery, but please, let's not just assume that because we see something on a scan that means you have to have surgery, because it really doesn't, and the data is robust on that. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.